Hello everyone, this is Nurse Alexis Gomez, and today I will be going over delegation. Nursing can be hectic, and most days I feel like I am a chicken without a head trying to administer medications, answer call lights, get vitals, and provide interventions to my patients. I am sure all of us have felt like this. However, we are not alone on our unit. We could take a load off by using a beautiful thing called delegation. What is delegation? Delegation means authorizing a specific individual to perform a certain nursing intervention during a specific situation. Delegation is part of nursing care, and it is a skill that requires critical thinking. Delegation skills can be developed over time, and it is a useful skill for all RNs. Although delegation is a skill that all nurses can use, delegation requirements can vary state to state and even through facilities, so be sure to review your state scope of practice and facility policies on delegation. Some things to consider when thinking about delegation are self-reflection. Do you feel you are capable of using critical thinking to delegate? Scope and standard of practice, facility policies, responsibility, and accountability. What is the person's skill set, educational background, training, and competency? Nurse's assessment. Is the patient too complex for this task? Intensity of supervision. Do I have to watch them like a hawk and keep checking in with them? If you are currently a nurse or a nursing student, you might be having a deja vu moment, because the things I mentioned before sound a lot like the 5 rights of delegation. Well, you are right. The 5 rights of delegation include the right person. Are they working within their scope, training, and competency? The right task. Can this task be delegated, or can it only be done by the nurse? The right circumstance. Is the patient too complex? Is the patient stable or unstable? The right directions and communication. Give clear, understandable directions and expectations. Give information like when you want the task done and how. The right supervision and evaluation. Be sure to follow up with the task you delegated to make sure it was done, and evaluate to see how it could be improved. A great tool to use to help in the delegation process is a decision tree developed by the American Nurses Association. So if you are like me and can't keep up with all the information nurses have to lock in our brains, here is a great visual on delegation. Remember how I said delegation can be different in each state? Well, I'm a nurse in Illinois, so here's an example of our scope. Illinois allows nurses to delegate medication administration to licensed practical nurses or unlicensed assistant personnel, but it is limited to PO, sub-Q, topical, or transdermal medications, and can only be done in a community health or in-home setting. If the setting is a long-term care setting, the UAP must have credentials of a medication aid and be within the policies of the facility. Now that we know more about delegation, I challenge you to see your state scope of nursing practice and facility policies on delegation. Let's work together to provide quality care.